The cholesterol theory of heart disease was based on low-quality research and driven by industry funding rather than actual evidence. And we have research evidence today that cholesterol is not the driver of plaque in arteries, and that lowering cholesterol with medications is not preventing heart disease. I've discussed this extensively in my books, courses, and other videos. Plaque is actually made up of fibrotic clotting tissue, and we have known for a long time that along with blood being too thick and direct damage to the artery lining, a main contributor to the formation of clotting tissue is inadequate or interrupted blood flow. In the 1950s and 60s, around the same time that the cholesterol theory was forming, researchers were finding something very different. One researcher showed that when looking at all the evidence, it was clear that blood flow dynamics in the arteries is the primary causative factor in the localization, inception, and progressive development of atherosclerosis. A more recent review article that assessed the research on the cause of plaque in arteries found that the evidence for what stimulates plaque development collectively indicate the dominant primary role of hemodynamics, which means blood flow. Even more recent literature has shown that inflammation and damage to the lining of the artery can be better explained by interruptions in adequate blood flow, and that plaque can form independent of inflammation or blood lipids when blood flow is not adequate or has been interrupted. So the real question we should be asking to prevent heart disease is not what our cholesterol is, but how do we maintain adequate blood flow? The answer is getting infrared light exposure from sunlight, grounding by being in direct contact with the earth, being metabolically healthy by optimizing our circadian rhythm and eating a lower carbohydrate diet, and moving your body with exercise. These are things I did to completely reverse plaque in my arteries while having cholesterol levels well above normal. These are also things that our modern way of life has largely kept us from doing as a society, which explains why we have the epidemic of heart disease we are seeing. For more information, check out my books and courses, or join my online health community. All can be found on my website, resourceyourhealth.com. Stay healthy out there.